Ethical considerations affecting confidentiality in sport. Confidentiality has been well documented to be an area of potential ethical conflict for sports medicine physicians. The importance of patient confidentiality has been recognised as an ethical principle integral to the role of a clinician and is even the concluding item of the Hippocratic Oath. Patients expect doctors to act exclusively to represent their best interests. To achieve this, confidentiality of medical information is necessary to facilitate privacy and requires trust in the doctor-patient relationship. Confidentiality is also linked to the principles of autonomy and informed consent. In this video, I'll summarise my findings from reading the literature on this topic, including guidance published by the General Medical Council, and also describe my thoughts and experiences from situations I've encountered as a general practitioner and club physician. I'll include the references in the notes accompanying this video. In their paper discussing ethical issues in sport, Anderson and Gerrard found issues regarding confidentiality to be amongst the most frequently ethical dilemmas encountered by sports doctors. They described the demands for health information by coaching and management teams as the primary cause for these situations developing. I have found decisions regarding disclosing medical information to be extremely challenging, both professionally and personally, and this is an area I've spent a lot of time reflecting on and discussing with colleagues. One study on confidentiality in professional sport questioned team physicians, physiotherapists and players in English professional football to analyse how they handle sensitive information. This study used interviews and questionnaires and managed to gain responses from 70 club doctors. This demonstrated that there was a considerable degree of variation in the level of disclosure of medical information to coaching staff. It highlighted the potential of conflict between players and the club's best interests and the strain that this can put on the player-doctor relationship. The authors attributed the variation between clubs to be largely due to the lack of commonly held code of ethics governing the level of information that's reasonable to disclose. It found that at some clubs, physicians were operating using the same rules they would do in general practice regarding confidentiality, whereas in other clubs, physicians were disclosing medical information much more freely. In this second approach, ethical dilemmas were much more frequently encountered. I think that these dilemmas arise most commonly from the conflict of wanting to keep the club and coaching staff as fully as informed as possible in order for decisions to be made to help the team succeed, balanced against the need for trust between the physician and player to allow decisions to be made to safeguard their health and fitness. Confidentiality is a crucial element of the doctor-patient relationship, and outside of the sporting setting, patients disclose sensitive information without the fear of this being disclosed to third parties. As doctors in the wider healthcare setting, we are usually exclusively an advocate for the patient's health and provide advice to them for them to make decisions to optimise this. However, as team physicians, we are employed by the club, which changes this dynamic considerably. It is recognised that team physicians working in professional sport have a contractual obligation to share health information which could affect decisions made by team management. In my experience, players are aware of this situation, and unfortunately this can affect what information they decide to disclose to the medical staff at a football club. The GMC states in its guidance on confidentiality that trust is an essential part of the doctor-patient relationship, and confidentiality is central to this. This guidance goes on to describe that if individuals think that their personal information will be disclosed by doctors without consent or the opportunity to exert some control over the timing or the amount of information shared, they may avoid seeking medical help. I think that this is really relevant to the sports setting where players often prioritise their career ahead of their health. This often results in them being reluctant to disclose symptoms to the medical team if they suspect that this information may be shared with the coaching staff and then affect their chances of selection for the next game. The GMC guidance goes on to state how doctors have both an ethical and legal obligation to protect patients' personal information from improper disclosure. However, there is an acceptance that appropriate information sharing is necessary to provide safe and effective care. Furthermore, patients may be put at risk if those who are providing their care do not have access to relevant, accurate and up-to-date information about them. The challenge in the sports setting is deciding what level of disclosure and information sharing is appropriate, as often our role is more aligned to that of an occupational health department than a personal physician. Disclosing information to the coaching and management staff is sometimes necessary to protect the best interests of the team and the club. Consent should ideally be sought before any disclosure of health information. Obtaining this can be a challenge, as players can be reluctant to share information if they think that doing so will jeopardise their immediate or long-term career. Furthermore, if players suspect their information will be shared with the coaching staff, they often choose to withhold declaring symptoms to the medical team. I've seen this lead to delayed presentations of illness and injury, which can result in both adverse health outcomes and suboptimal management of injuries. The GMC guidance concludes that in challenging situations when a clinician is not sure how the law applies in a particular situation, they should consult a Caldicott or data guardian, a data protection officer, a defence body or a professional association, or seek independent legal advice. In my experience, the defence organisations are an invaluable resource for supporting clinicians when faced with difficult decisions. It is also reassuring to know that they are supportive of any difficult decision, especially in the event of any subsequent litigation. Other measures that can be taken include triangulation of opinion with colleagues to ensure that other clinicians in similar roles are supportive of your decisions and feel your actions and decisions sound reasonable. It is important in ethically challenging cases, especially involving breaches of confidentiality, to ensure documentation is thorough and robust. Detailed and timely documentation, including explanation of reasoning behind decisions, to disclose information and the length taken to obtain consent from the player before doing so, can prove invaluable. And should a case result in litigation, this is extremely relevant. I've recently been involved in a legal case to our practice which was eventually abandoned by the claimants due to robust documentation being available, which both contradicted their claim and showed that the standard of care was thorough and considered. Had it not been for this documentation, there may have been a situation of their word against ours, which can be difficult to articulate if the case was several years in the past, as is often the case. So to summarise my reflections on this topic of confidentiality within sports medicine, I would say that the following steps are crucial to ensure good standards of care, maintain trust in the doctor-patient relationship, and minimise the chances of litigation. Firstly, familiarisation with the law on data protection and guidance on confidentiality such as that produced by the GMC. Secondly, taking time to evaluate the ethical considerations that are associated with decisions regarding disclosure of information. Thirdly, seeking consent from the individual before any disclosure of medical information. This may involve explaining that appropriate information sharing is necessary to provide safe and effective care for them and safeguard the best interests of the rest of the team or the club. Fourthly, ensuring any disclosure of information is kept to a minimum. Fifthly, reassuring the players that medical information will not be shared with the coaching staff if it doesn't directly affect their ability to participate in training or matches. Seeking advice from colleagues and defence organisations, especially if situations where consent from the player can't be obtained. And finally, ensuring thorough and robust documentation, including reasoning behind decision making and detailing prior consent to disclose information. Thanks.